to the CDC, Florida has received 1,137,000 doses of the vaccine, including 367,000 of the Moderna vaccine, which was delivered last Wednesday. That is enough for 2 doses to 568,000 people, which is one of the problems that I will be discussing shortly. Let me discuss some of the problems that we've been having. There has not been any coordinated national plan to distribute the vaccines. There has not been sufficient federal aid, and the aid that has been forthcoming is only starting this week. The biggest problem, however, is the number of vaccines available. Governor DeSantis announced that seniors would receive priority to receive vaccines. He inadvertently appears to have given seniors the inaccurate belief that they can register immediately for the vaccine and that they can all receive vaccinations now. To be clear, he never said that, but it appears that he also didn't clarify that seniors would have to wait 4 months for the vaccines. As I said, the state has enough vaccines for 568,000 people, and healthcare providers are the first people that are receiving those vaccines so that they can care for everyone else. There are over 4.5 million seniors in Florida, so maybe there's enough vaccines to immunize approximately 10% of Florida seniors right now. Unfortunately, most seniors want and think that they can receive the vaccine right now, which the numbers simply don't support, and that is creating a huge bottleneck. At each location run by the Florida Department of Health in Broward County, they can vaccinate currently around 500 people per day. Each location is or will be open 5 days a week, but the days will be staggered so that there will be locations in Broward County that are open every day of the week. Each location will have reservations made for 3 weeks in advance. Broward County has about 340,000 seniors. With only 2 locations open, the Department of Health in Broward was only able to serve 500 people per day times 5 days, or 2,500 people per week per location, or 5,000 people per week with the 2 locations that were open. The Department of Health had to quickly build a website because they didn't have a lot of notice that this was going to be going to seniors only, or seniors with priority. And the website crashed under the load here in Broward. If they have 8 sites open, which I mentioned the sites that will be open this week and the expected 3 to 5 additional ones, with 8 sites open, they can vaccinate at least 20,000 people per week, maybe more, as the Florida Department of Health, as the Florida Department of Emergency Management has just hired 1,000 more nurses to help the Florida Department of Health statewide in administering the vaccines. As each new Department of Health location opens, they will reopen the Broward County website for new reservations for the first 3 weeks at that location. Also, the Florida Department of Health in Broward will reopen the website as they vaccinate each week so that they'll always stay about 3 weeks ahead. As of yesterday, the Department of Health had not decided if they'd book each day, that is, if you finish one day, they'd open another day, or if they would book each week, as in finish 1 week, then reopen them for an additional week. As of yesterday, they had not reached a decision. I spoke with Dr. Thatchy, who's the director of the Florida Department of Health in Broward, yesterday evening, and there was no decision yet on that. With 8 sites open and additional help to administer vaccines, the Department of Health sites alone not counting the hospitals or the ones run by emergency management, should be able to vaccinate between 85 and 100,000 seniors in Broward County each month. When you add in the hospitals, the Department of Emergency Management, and the drugstores, every senior that wants a vaccination should be able to get one in the next 2 to 3 months, but not tomorrow. And it's important to understand that not everyone will be vaccinated tomorrow or this week or this month. And by the way, that 2 to 3 month period assumes that the supply of vaccines holds out, which at this point in time is an unknown quantity. A couple of housekeeping items. First, I am begging you, and I beg a lot, I beg you to wear masks, and now I'm begging, please do not show up at the hospitals or at the Department of Health vaccination sites without an appointment. You will be turned away, and you will tremendously inconvenience and delay those people that do have reservations. Do not show up without a reservation. The hospitals and the Department of Health are by reservation only. We do not want to see what has happened in other counties. And by the way, each county in Florida Department of Health has the ability to set it up however they want to. Some counties have said first come, first served, and you have seen lines of seniors waiting overnight. We do not want that in Broward County. That is not the procedure in Broward County. Do not show up without a reservation. When you do receive your first inoculation, you should also receive the appointment for your second vaccination. It is 3 weeks apart with the Pfizer vaccine, 4 weeks apart with the Moderna vaccine. You should receive your appointment. Again, this is assuming that the supply of vaccines holds up, which we've been told that the Florida Department of Health believes that they will, but again, that is subject to the federal government and simply the vaccine supply. I would like to thank Dr. Paula Thatchy, the director of the Florida Department of Health in Broward County, for working around the clock and for always being available to answer my questions, the questions of the legislature and of our congressional delegation. Again, there are a great many dedicated public servants out there working on this. I know I was on the phone with them all day yesterday and yesterday evening trying to get all of this data. It is unfortunate that the data is resting with the Department of Health, with the hospitals and the individual hospitals and Department of Emergency Management, and it has been very difficult to assemble all of the data. Broward County is going to try, and we sent out an email yesterday, to try and get all of this data out to people on a coordinated basis, which again is difficult because of the different agencies, and there is simply not coordination between them. For those many of you that have been calling me, asking for the secret number to bypass the line, it's 1-900-999-9999. Just kidding. I know that most people believe that there is a secret number that I can give you. There isn't. I have not received a vaccination yet, because there is no secret number. You don't get to jump the line. I'm not jumping the line, and there is no secret number, so please stop calling me and asking for it. That concludes today's press conference of my prepared remarks, and at this point in time, I'll be happy to answer any questions. Yes, please identify yourself, and I'm sorry, y'all are wearing masks, so just when I call on you, tell me who you are and then what your question is.
Going there believe they have registered, they are finding
That's a good question. I wish I had a better answer for you. As I said, Broward County is assisting as much as we can, but it's a state agency that is running that. Dr. Thatchy has told me that they are continuing to improve their website. Obviously, when they set it up, they were not expecting hundreds of thousands of people to be calling them, and they're getting, with repeat calls, I wouldn't be surprised if they're getting 1 million emails or calls a day. The state agency has assured me that they are getting the people that have reservations, and they suspect that the people that sometimes may think that they have a reservation don't. Are you telling me that they have written confirmation from the state and then it doesn't show when they show up?
Yes, we found both people who they were glad they had brought like a screenshot or something to prove it, because when they got there, their name was not on the list. And unless you had that proof, they weren't giving it to you.
Okay.
Could it be some user error? Maybe, but there are people who are getting a confirmation and their name is not. So there's some disconnect going on.
I will check with the Florida Department of Health at the conclusion of this press conference. I will call Dr. Thatchy. I simply don't know, because, again, you can ask me about the federal government, and I can't control that either. But I am concerned about what you're saying. I have not heard that before. I probably should have been watching your news program yesterday.
The big problem is people feel they don't have anywhere to go, because if you have waited in line at least an hour, and
Right.
then they're telling you no, they just say, sorry, you're rejected, and I guess your only recourse is to go home and try to re-register.
Again, I hadn't heard this before, but if it was a county agency, I could tell you, yeah, we'll put extra people there, we'll do this or that. It's not, but I will certainly, it sounds like it's a real problem, and I will speak with Dr. Thatchy. And if you'd like, I'll try and, Josh, please make sure that you get her name and number, and I'll try and get back with you after I check with the Department of Health today. Yes. Oh, all right. Yes, sir.
This storm that's about to take place or is expected, was something that was foreseen. You got businesses that are allowing clients to come in, maskless, you got people challenging storefronts about whether or not they need to wear a mask. But yet, you know that the supply chain is going to break at some point. What's your gut feeling about why it's turned into this? Or is this the ongoing?
There are several answers. First, I have to blame our president for a lot of what's going on. I believe that he has politicized this. This is, do I have a mask? I have a spare one in case my current one breaks. This is a medical device. It is not a political argument. President Trump has made it into a political argument. People have stated that they have a constitutional right not to wear a mask, and I promise you there is no such right. People have said that, if God had meant them to wear masks, they'd have been born with a fig leaf or something. These are just not rational arguments. There is no major religion that I'm aware of that says that you cannot wear a mask. There is no constitutional right, and candidly, people that are not wearing masks are endangering themselves, their communities, and their families. I am highly concerned about this. I have been strong and consistent in urging people to wear masks and urging the county to fine or close down places that are not wearing masks because it's the only thing that will protect the country. Additionally, so that's one problem. The other problem is that my glasses are foggy. No, the other problem is that in Washington, which can be dysfunctional, they have not provided sufficient funding and they have not done it early enough to assist with the rollout of the vaccine. They have not given plans. Every state is doing it differently. And in Florida, every county health agency can do it however they want. I don't think that was a good idea. I think it would have been a better idea if there had been preparation at the federal level and at the state level and uniformity. I hope that answers your question. Did you have a follow-up? Did I answer you? Yes, sir. I'm sorry, louder.
Something. Give us an idea of how you would characterize that anxiety.
Well, first of all, I'm not sure if I would use the word anxiety. The question was, what word would I use to describe the anxiety? And the answer is, I'm not sure I would use the word anxiety at all. In some cases, it's outright anger. I mean, I've read some of the emails that I have received and heard summaries of the phone calls, and people out there are just angry at what they perceive to be the incompetence of the county and its distribution plan. I tell them that it's not the county's distribution plan, but that doesn't make them any less unhappy. They know that government has failed them. Which level of government is a question, but they believe that government has failed them. One of the problems, again, unfortunately, and the governor never said that there were sufficient vaccines to give every senior their vaccination immediately, but I believe he may have given that impression to seniors, or at least that's what seniors heard. So the seniors are all panicking. I shouldn't say all. Many of the seniors are panicking because they think that they were promised the vaccination immediately. They were not, but now they're feeling that, faith has been broken with them. And people in general, there's a high level of anxiety among some people. As you can see from the pictures, some people just don't care at all about the pandemic. They don't think that it's any worse than the flu, again, because the President of the United States has said that. And I've seen pictures and videos on the news of people in the emergency room, young people and older people, that were told that it was a hoax and they didn't need to wear masks, and they're in intensive care now. So, yes, I agree that government has not met their expectations. I think that a lot of this has come down from the national level, and at the state level, I'm afraid that they may have been given unreasonable expectations. It's a matter of math. There are not enough vaccines in the state of Florida. If we could give everybody a vaccine tomorrow, if there was sufficient locations and staff to do that. There's not enough vaccine and probably won't be for the next couple of months. And that's just for the seniors. Yes, ma'am.
With the positivity rate going up,
Yes.
do you see hospital overload happening here in South Florida like we're seeing in California?
I hope not, and that's one of the reasons I'm begging people to wear masks. But if you look at, when I had last checked at Memorial, and again, I represent South County, so that's the one I'm most familiar with. They had 133 emergency room beds and 166 patients. They have been able to convert other rooms to intensive care rooms, but they had I may have said emergency rooms. They had 133 intensive care rooms and 166 patients. So they've had to convert some rooms. As you can see in the charts, the hospital admissions are going up and the hospital patient census are going up. The charts are right there in front of you. Are we in a crisis today? No. If the numbers continue to increase, and we know that they will, at least for the next week or 10 days, because of the Christmas and New Year's holidays, we know that those numbers are going to increase. People I try and listen to the experts, whether they're scientists or physicians, but those are the two experts that I try and listen to. They have all predicted that January and February are going to be much worse than other months have been. Now, it is possible, and I hope that in Florida it won't be as bad. I believe that they're hoping that they're suggesting in a lot of the rest of the country it will be horrible because of the cold weather and people would be indoors more. And in Florida, obviously, that's not the case. But the numbers are clear. We are going back. We were over 10% yesterday. And I expect the numbers will continue to worsen. Do you know how we can fight that? Wear your masks, social distance. I mean, it's not rocket science. So I'm hoping that we can avoid the types of crisis that you're seeing in California and other states. Are there any additional questions? Sir.
Mr. Mayor, always good to see you, albeit not under these conditions and at this distance, but the best to you.
Thank you.
Related to all of this, I talked to Judge Tudor the other day, the Chief Judge,
Yes.
About the problem with the mounting number of eviction claims that are in there, that are in the court, and that are there, and that at the end of the month, unless there's another extension, the moratorium will expire.
Yes, sir.
He said to me that the county manager might have some funds under the COVID money, under the CARES Act money that could be rolled over. Can you tell me what you're trying to do to address that? Ron Book, who we both know well, said to me, hey, look, we're going to have people survive the pandemic and die on the street because they don't have a place to live.
There are so many needs and such a small amount of money. As you know, one of the two biggest fights in the United States Congress was over money for state and local governments. The two were the Republicans were asking for a liability protection. The Democrats were asking for money for state and local government, and neither got what they wanted. We did get an initial infusion of CARES Act money. Some of this went to local governments. Broward was one of the few counties in the state that gave a direct share of the money to the cities. The cities did not spend all of that, so some of that money has come back to the county. I don't know where to put it. I mean, we did put money towards rent relief and mortgage assistance. They're separate items. They're related, but it is not going to work for landlords to never receive rent because they have expenses as well, which is why a mortgage assistance or rent relief are helpful. The Broward County put a substantial amount of money towards that. We also are very worried the food banks are running out of food and money at the time that the demand is higher. I mean, where do we put the money? Do we put it for food or do we put it for housing? The answer is we're putting some money towards both, and we are expecting that there will be some, as you say, the CARES Act money that will go towards both food, the food banks, Feeding South Florida in particular, and also will be going towards rent relief and mortgage assistance. But there are so many. We're also trying to help pay for vaccinations through, various sharing some of the costs. So we're going to do everything we can. If you're asking me whether we're going to do more for food or for vaccinations or for rent relief and mortgage relief, I can't answer that. We're going to try and help as much as we can in all of these necessary areas. Follow up?
As we get to the end of the month,
Yeah.
can we stay in touch so that we'll know whether or not to tell your constituents at the end of the month to reach out to the county if Ms. Henry actually has these funds? As Judge Tudor indicated, it might be possible for them to reach out in the system that you have in place for those to be dispensed, just in case
Okay.
they're not able to reach an agreement in mediation.
Let me explain what we have done in our rent relief, and which I think is candidly was a very smart way of dealing with this. What we've done is if you have a landlord and he's 6 or 8 months behind in the rent, he can evict the tenant. But if she does evict the tenant, the chances of them actually, they can get a deficiency judgment, but the chances of collecting on that aren't very good. So what we have done is come up with a tiered approach and say, all right, landlord, if you will agree to accept this as payment in full, we will pay you X percent for the first 6 months or the most recent 6 months and a lesser percent for the amount before that. So you will not be made whole, but at least you will get a substantial amount of money that way, but that is only if you agree to accept that as payment in full. So we've been able to stretch our dollars that way. That does require the tenant to also have worked with the landlord to get him to agree to accept that as payment in full. So well, I'm happy to, as we get closer to the end of the month, feel free to contact me and I'll, check and get back with you immediately.
Appreciate it. Not in your lane, though, but unfortunately, Judge Tudor indicated to me that some of the landlords now, they're not even making a filing the claim. They're just letting the lease expire, and then we have a trespass.
Yeah.
And so that basically circumvents the system.
I know
Thank you,
Judge
Mr.
Tudor
Mayor.
well. I've worked with him on many items. In fact, he swore me in both as county commissioner when I was just reelected and as mayor. Are there any additional questions? Are there any additional questions? My glasses are fogging, so I can't see. Are there any additional questions? I don't see any. Josh, are there any? Okay. If there are no additional questions, again, thank you, and I'll be giving some remarks shortly in Spanish.